Hi guys, now I will be discussing substance abuse. Substance abuse is use of drug in amounts or by methods which are harmful to the individual or others. It is a form of substance-related disorder. It includes drug abuse, which is a non-permissive consumption of certain substance that may lead to physical and psychological dependence. Like example, a person may take more of the drugs than what it is being prescribed, or drugs may be taken by people who were not prescribed by the medication. Drug addiction, it is a brain condition that refers to intense seeking, cravings, and using of a substance even though it is harmful. They cannot resist or the use of drugs. They always crave for it. Withdrawal syndrome, it is an abnormal physical or psychological features that follow the abrupt discontinuation of drugs that has the capability of producing physical dependence. It happens when suddenly you stop the use of drugs. Then you will feel like sweating or goosebump. You feel like vomiting. You feel anxiety, insomnia, and even you will feel muscle pain. Now, why do people use substance? Experimenting or being curious with drugs or alcohol. It is a scenario that often started with young person. Family history. If you have a family history of drug addiction, you may have a genetic disposition to develop also addiction to alcohol or drugs. Prescription to drugs. Many individuals are not properly educated on the risk that the medication may carry. Loneliness. Individual who feels lonely or isolated from friends and family, they may turn to drugs and alcohol thinking that it will fill a void that they have been living with. Peer pressure or usually applies to adolescent or young adult, the need to fit in on some level. The pressure of being around others who are abusing drugs or and alcohol can push someone to follow as well. Now we go to signs. There is physical and behavior signs like sudden weight loss or gain weight, deterioration of physical appearance, loss of coordination, like declining grades for student, poor judgment, declining in performance if they are working, financial problem or suddenly losing valuable things and money, unexplained anxiety or feeling hopeless, depressed, or feeling run down, accident prone trouble like drinking and driving, memory loss or blackout, or forgetting what they did. What are the treatment? Behavioral therapy can be done by psychiatrists. It help you develop ways to cope with your drug cravings. They also suggest strategies to avoid drugs or prevent relapse. Education and counseling. It can also decrease the sense of shame and isolation that can lead to relapse. Detoxification or withdrawal therapy. It is to enable you to stop taking addicting drug as quickly as safely as possible, and change of social environment. You need to avoid parties and gathering where alcohol and drugs are present, or look for a new friends to associate with, or initiate new hobbies and activities. Um, they said treatment, knowledge, and right support will result to recovery. Thank you guys.